Antibiotics have transformed modern medicine, but their journey into the spotlight began in a humble laboratory with Alexander Fleming's serendipitous discovery of penicillin in 1928. Initially set aside as a curious finding rather than the cornerstone of medical therapy, penicillin's potential was realized during the exigencies of World War II, when it turned the tide against bacterial infections that previously led to countless casualties. The use of antibiotics represents a fascinating saga of medical innovation. These medications, designed to combat bacterial infections, work either by killing bacteria directly or inhibiting their growth. There are various classes of antibiotics, each targeting different mechanisms within bacterial cells. Beta-lactams, such as penicillin, interfere with cell wall synthesis, while tetracyclines are known to disrupt protein synthesis within bacterial cells. The development of antibiotics didn't halt with penicillin. In the post-war years, researchers embarked on an exploratory sojourn to discover new antibacterial agents, leading to the introduction of a vast array of antibiotics like streptomycin, chloramphenicol, and erythromycin. At the crux of their profound impact on public health lay not just the ability to treat previously fatal infections, but also the opportunity to perform surgeries and medical procedures with less risk of infection. Antibiotics made it possible to save lives that were once doomed. However, with great power comes great responsibility. Mankind quickly realized that indiscriminate use of antibiotics posed a grave danger: the threat of antibiotic resistance. Bacteria, always evolving, have developed mechanisms to overcome these drugs that were once lethal to them. The phenomenon of resistance is exacerbated by the misuse and overuse of antibiotics in healthcare and agriculture, leading to superbugs that resist multiple drugs. As antibiotic resistance continues to rise, researchers and healthcare professionals strive to find novel solutions. This includes developing new antibiotics, reviving old ones, and implementing stewardship programs to ensure responsible use. The scientific community advocates for a more personalized approach to antibiotic therapy, where genetic and molecular diagnostics guide the application of the most effective treatment, minimizing resistance development. Education and awareness are imperative to curb the tide of resistance. Public health campaigns inform both clinicians and patients about the risks of overusing antibiotics and the importance of completing prescribed courses. Meanwhile, global cooperation projects aim to monitor resistance patterns and alter guidelines as needed. Though antibiotics are a cornerstone of contemporary medicine, they remain a tool to be wielded with caution. Balancing the marvel of therapeutic intervention with vigilant awareness is key to ensuring that these life-saving drugs continue to serve humanity for generations to come.